I think initiating conversation early on, but not just leaving it at that. Asking what their experience is with breastfeeding. What do they know about it? What does that look like within your family? Some families that don't have that experience or don't have that support, how can I, right? What are your goals? How can we achieve that goal? What feels good to you? What feels right to you? I think also being informed of patients if they have a history of trauma, making sure that there's enough support there or options, so that mom's able to, if that's her goal, to breastfeed.
Building trust, the expert is the person you're speaking with. It's always the person you're speaking with. So asking lots of questions, um, getting an understanding of who are their support people, whether it be family, friends. Are they getting their information from TikTok, social media? Um, we know that historically there has been some trauma that has been done to eliminate breastfeeding. And so educating people and getting that back to be the narrative is what's important. Um, you don't know where somebody comes from or if they've had experience. And so asking lots of questions is where you're going to get your information.
Well, I would say I have to advise to give to everyone or every provider that is in connections or interactions with women, especially women of color, about lactation or breastfeeding. And the first one is understanding the cultural norms. I think that's very important because we have diverse set of people, diverse belief, diverse culture. People have 1,001 belief system of why they can do this and not. And I believe that providers, support groups, healthcare, whatever, that can, if they can understand the cultural norms, at least to some extent, of what is involved in different cultures in relating to lactation, relating to breastfeeding, would really help in establishing connections and trust with the mothers.
Not putting my expectations on what breastfeeding is like. But, what is it for you? Is breastfeeding all the time exclusively? Maybe not. For some people, and any amount of breastfeeding is considered breastfeeding. Maybe they're only pumping because they feel uncomfortable about it. And it's not my place to tell them what is truly breastfeeding. And I think that that is an error I constantly see where some people who really advocate for breastfeeding, they're like, oh, this is everything and that's all you got to do. And there's nothing in between. And if you're pumping or if you're bottle feeding some formula and breastfeeding, that's not really truly breastfeeding. So really stepping away from who you are and really believing that the people that you're serving know who they are and listen with an open mind and not put your own expectations on other people